make a start. So handing over to Anna, who's going to say, don't forget you're being recorded.
Yes, don't forget you're being recorded.
Next slide, please, Sarah. Oh, it's going to do that thing where it lags a little bit. Brilliant. Okay, so we've got a local COVID update from Anna and a vaccine update. We've got Natalie here to talk about the community book, and then we've got a few campaigns and of course some information about the easing of lockdown and a couple of other things, including just wanting to highlight the brilliant community choir piece that's been done around COVID. So we'll just make sure that we leave kind of a couple of minutes at the end to see if we can have a look at that. So next slide, please, and over to Anna. I'll keep an eye on the waiting room and keep admitting people as they arrive.
Yeah, next slide, please. So I will sort of be brief because we haven't got a lot of time, but you'll all be aware that with the Delta variant, which potentially is about between 40 and 60% more infectious than the previous variant, we are seeing those cases rise, particularly in young people. When you've had 2 vaccinations, it does provide really good protection against the Delta variant. But obviously, you just need to be mindful that after that second vaccination, you need to allow a couple of weeks to get that full effect. If you just do the next slide. I just kept this in. This is, I think I've got just to show you the sort of picture within West Yorkshire, and to show that positivity rate is starting to go up again, which we know is a bit of a warning sign that we're getting more obviously getting more cases. Can I have the next slide, please? I don't normally show you this slide. This is Public Health England data that I get on a daily basis, but I wanted to today. And that's so this is all of the place in Yorkshire and Humber, and then the Yorkshire and Humber and England average at the bottom. And if you look at that farthest right column, so that's not validated data, that's sort of hot off the press data that shows us what's happening. And actually, if I showed you today's data, what we're seeing is those really quick rises, particularly in Leeds and Kirtlees, Bradford and Calderdale. We're not seeing quite that same picture in Wakefield. So what we are seeing in Wakefield was a rise from 60 to kind of mid 80s, but that has stayed fairly stable. But those other areas in West Yorkshire are doing kind of, you'll have heard of things like surge testing, and we are going to be doing a similar approach, but ours is going to be very much around door knocking, vaccinations, supporting people to isolate, etc. And we just start exploring a little bit about what that will look like. But actually, we're not in the same position as some of those other West Yorkshire local authorities at the moment, so that is positive. Next slide, please. So this is really what we're seeing and what everybody's seeing, those very high rates in that 19 to 24 and sort of a little bit above age group. So that's sort of 11 to probably 30 age group. So the good news about that is that we know that we don't tend to get serious disease or death within those age groups. But obviously it's incredibly disruptive for children, and it's just, you know, the poor schools at the moment, what they're having to deal with the Delta variant being so much more infectious. We're getting a lot more positive cases, which means a lot of bubbles are bursting, which means a lot of children are being sent home, and that has a huge knock-on effect for their families and all sorts of other things. So it's really challenging, and I have a sort of 2 weekly briefing, not just me, but all directors of public health with the chief medical officer, and I raised this issue around the impact that it's having on children's education. One reason why we're not vaccinating children is because COVID doesn't have a particularly big impact on their health, but obviously you know, health and education are linked, and in areas like Wakefield district, where, you know, it's really important that all of our children get a really good education, it is going to be an issue if children keep getting sent home for 10-day periods. So I've sort of flagged that as a real concern of mine as Director of Public Health. Next slide, please. Yeah, so again, just to sort of give you a slightly different map this week, and you'll see how kind of in the northwest of the country you've got those really high rates. So I think we've got some places as high as 800 per 100,000 again, and again it's what you see with a new very infectious variant in an unvaccinated population, sort of going through that population very quickly. we heard from the Director of Public Health of Blackburn, who is obviously within that area, and what they're not seeing is particularly high rates of hospitalisation, and they're not seeing increased deaths. So that again is a positive and a testament to the vaccination campaign. Next slide, please. So again, in Wakefield, quite overall, although our rates have gone up, it tends to be quite concentrated. So again, we're not seeing, that map isn't looking anything like the map of the Northwest, but still, and as I've said, we've seemed to have stabilised a bit over the last sort of 4 or 5 days. So we'll have to see what happens. Next slide, please. And again, I always show you this. It's just showing that we've got lots of stuff happening, and a lot of that is still in workplaces, which again, with less infectious variants, you wouldn't get that kind of spread. But the Delta variant, we're seeing a lot greater proportion of contacts becoming positive cases. Next slide, please. But in terms of our admissions, you can see that red are non-Wakefield residents. So those are Kirklees residents, most of whom are in the Dewsbury site, not the Pinderfield site. Actually, although there's a tiny increase in Wakefield residents with COVID patients, it's still very, very low. And that's what's really different about normally with rates that had increased as much as that, we're just seeing a lot more admissions, but we're not seeing that. The people that are being admitted tend to be younger people, and they tend to be much less serious, and they tend to be out really quickly, like within a couple of days. So and it's generally in the older population, it's those people who haven't had the 2 vaccines that are ending up being admitted to hospital. Next slide, please. And again, deaths, we're not seeing at this stage, we're not seeing a rise in deaths. So again, that is very positive. Next slide, please. Yeah, so I think those are my slides over with, and I think can't see the chat, but can't see anything. Hang on. But I can't see the chat, but I'm guessing we haven't got any questions.
So no, I can't see any questions, Anna. So I guess the next bit is just about the vaccination programme in Wakefield. So fantastic effort. So that's 217,000 people have been vaccinated, and 70% of people almost in their 30s have come forward for their jab at the earliest opportunity. So just to congratulate a huge amount of primary care staff, admin staff, volunteers, and everybody else for getting that word out, and of course yourselves as COVID community champions for continuing to spread that message. Thank you very much there. Let's just, and please just keep encouraging people to keep forward as soon as possible. Next slide, please. So we'll just take a pause there before we hand over to Natalie to talk about her project. Lindsay's got a question. Lots of people struggling to get in today with the updated link. Yes, so Lindsay, we've due to an upgrade of the Zoom account, we've needed to change the link. We thought we'd change the settings to allow everybody in, but if there is anybody who's struggling to get in, can you just let us know? We do think we changed the settings so everyone can get in, so can they just please keep trying? And for anybody who's struggling to get in, I do apologise, we've changed all the settings that we know about. Okay, so Natalie, can we hand over to you, please, because you've got a brilliant new project that I'm really happy that you're here to share with us.
Yeah, thank you, Kerry. So my name's Natalie. I work for Nova Wakefield District, and I'm attending today to introduce a new directory for the district, which is Community Wakefield. So the new place, services, activities, opportunities and events across the district. Next slide, please. Yeah, so the purpose of the site. So last year, Nova received funding from Public Health to undertake the project. Seems like ages ago now, but like I said, pandemic and a couple of lockdowns later, the site is nearly ready to launch. So the idea of the site is that community groups, organisations, statutory organisations can add their groups, sessions, activities, events to the website, and they'll do this by having a profile. So everything will be managed by each individual organisation, pretty much like the Volunteer Wakefield site that was set up a couple of years ago. And the Volunteer Wakefield site has been used recently to coordinate all the Community Hub volunteer vacancies in response to COVID. So this hope is that this directory will sort of be accepted by all, used by all, and will really be like the one-stop shop for everything activity-wise in the district. Next slide, please. So I went out to tender for the design of the site, and we chose Let's Dance agency, the designers of the Volunteer Wakefield site, to undertake the project, and they supported Nova to do some consultation and research. So within that, we held focus groups with partners, we held focus groups with voluntary sector organisations, we undertook market research on similar sites in other areas of the UK, and we surveyed members of the district to find out how they currently find out about what's happening and how they feel it could be improved. And we've shared previews of the site throughout with colleagues and gained feedback throughout. Next slide, please. So what you can do on the site. So as an organisation, if you're wanting to add something to the site, you can quickly and simply promote your activities, your events, services, and you can also advertise your volunteer opportunities through that as well. So if you're an organisation that's already got a profile set up for Volunteer Wakefield, you can also do both together. We thought that was really important. So it's not too many logins for loads of different stuff. You can be found and contacted easily. You'll receive emails reminding you when your listings need reviewing, so you'll get that prompt so that nothing goes out of date. And you can have multiple team members able to manage your organisation's listings. So if you're like a bigger organisation, you've got a few different departments, you can set up a team within the site, so you can easily manage those between you. And there is a video tutorial of how to use the website in more detail there. I'll share the slides after this so people can watch that in their own time. So I'm conscious that we're a bit tight today. So next slide, please. So as a user of the site, you will be able to easily search for activities, services and events in Wakefield District. You'll be able to search by category, you'll be able to search by area of the district, you'll be able to search by distance from your home, and you'll also be able to search by how you are feeling. And you'll easily gain full information on a range of things that you've searched for all in one place. Next slide, please. So the launch. So as of yesterday, the website is built, which is brilliant news. So that means a lot of work now for us to, number one, promote it to organisations to encourage people to list their stuff on there. And then the second part will be a district-wide advertising campaign when the site is listed, to advertise it to the public, to partners, so that people are aware of it, and it's both ways to add for people to add to it and for people to reference it and sort of point it out to whoever they're working with or families as just an extra thing, to find things, everything Wakefield district related. Next slide, please. So I've put a quick tour in here, but I'm not sure if I've got time or not, and I'm not hosting, so I can't click on the link. So the link's in there. I'll leave it up to you, Kerry, to decide if we've got time to look at it yet, or people can look at it in their own time. It's up to you. Oh, I think you're on.
Kerry, you're on mute.
Sorry, feels like we're back at the beginning. Tech problems and leaving yourself on mute today. Yeah, I'll put the link in the chat bar.
Yeah, brilliant. And just on the previous slide, if anybody does have any questions or anything, my contact details were on the previous slide.
Natalie, I think it's an excellent piece of work, and you've done a fabulous job, and it's brilliant. And can you send me your slides so I can promote it far and wide, please?
Yeah, will do. Thank you.
Well done.
Thank you.
So just to follow up from that, I think all of the COVID community champions have a really important role to play in bringing this to life, in getting those messages out, signposting people, both providing content but also letting people know. And it's, you know, these things are only as good as they are used, aren't they? So I'd really encourage people to have a look, and perhaps next week, if anybody's got any feedback either in between or next week, we'd be really interested to hear that. Is that okay, Natalie?
Yeah, that's perfect. Thank you.
Thank you. Okay, thanks Natalie for coming. If we could move on to the next slide. I'm not sure who's talking to this. Is this Neve talking to this slide? Resounding silence. Yep.
Neve prepared it for us, but I'm not sure if she's in the meeting.
Oh, maybe she's not needed. Okay, Tracy, do you want to speak to this, or do you like me to?
I can read it out if that's helpful. Yeah, our council's team has launched a campaign, a Be Kind campaign, and it's asking residents to be kind to each other and protect each other when they're out and about as well. They've done lots of posters, and some of our COVID champions have inputted advice and information about the Be Kind campaign, particularly those with hidden impairments, to just remind the general public, please, to be kind to each other. And the campaign advises that services may look a little different and take a little longer, as everyone's doing their best to ensure that places are COVID secure. So to just be a little bit more patient when you're queuing and waiting for things, really. And it reminds you about empathy towards others, and that people's experience of the pandemic has been very different. Some people have been at home shielding for a long time, particularly those who are vulnerable or elderly. And some people have reported feeling really frightened about coming back to normal. So it's been a really good Be Kind campaign, and an excellent video has been done featuring some of our COVID champions. We really wanted to show it to you today, but technical problems have got the better of us. But there's a link. It's only a few minutes long, and it's definitely worth watching.
Thank you, Tracy. And I think we're all in a position where we can understand that, you know, for some people it feels really scary, that restrictions are increasing, you know, increasingly easing, and it feels very busy out there. Staff are really under pressure with new restrictions, and they're struggling as well. And for some people, they're really frustrated that, you know, we can't just get back to normal, whatever that new normal is. So I think it's really worth emphasising that, you know, we've all been in this together for a long time, and it's hard, and it's still hard. It's still hard for lots of people. So thank you for that. Next slide, please. And yeah, just a reminder, as I'm sure we all know, of a delay to step 4 of the roadmap. So this will be reviewed no later than 12th of July, with the expectation that we'll move on to step 4 on the 19th of July. And Anna, if you've got any kind of comments at this point, please do feel free to jump in. The pause allows all the over 40s and the clinically vulnerable to have their second dose, and for all of the over 18s to receive their first dose. So again, when we were looking at the heat map of where infections are in terms of the age profile, that does feel really important. And it, as we've already said, the vaccination does appear to be reducing how serious the illness is if you do happen to get it. So I don't think there's anything else that we haven't covered already, in terms of please encourage people to take up the vaccination, get them to come forward with any of their questions, get them to have their second dose if they've not yet had that, and just to remind people that we still do need to test and trace and self-isolate in the same way, and looking at the rising case rates, that's even more important. Remember, hands, face, space and fresh air. So although you might be able to meet inside, if you can meet outside. Is there anything else you want to add to that, Anna, at this point, or I think we've kind of covered lots of it.
No, I mean, I think just practically, if you're like me and you haven't had your second vaccine yet, then the Delta variant, it does, whereas the previous variant, you could get pretty good coverage if you'd had your first vaccine. With the Delta variant, we're not seeing that. You do need to have that second vaccine. And then just remember, you do need that 2 weeks as well afterwards. So I'm just being, because Leeds figures are through the roof and that's where I live. So I'm being super, super cautious until that's happened. If you've had both vaccinations, then you are protected, you know, although the vaccine won't work for 100% of everybody. So again, still worth being really cautious. But you know, it is deeply frustrating, I know, for everybody. So, and hopefully things, you know, once everyone's been vaccinated who can be, we will see those numbers come down. So yeah.
Thanks, Anna. As you said, deeply frustrating for everybody, but we are led by the science. It's not, yeah, that's where we are. So moving on to the next slide, please. We had a couple of questions. So there's a question about whether people can, about events, specifically about a summer gala on July the 18th and what precautions should be taken, and other large events that are planned as well. So I don't know if you want to answer that one first, Anna.
So I think for each event it's difficult to kind of answer a sort of question without understanding more of the detail. There is really good guidance on the gov.uk website, and if you need more specific guidance you can email the health protection inbox. So we could probably I think it's health protection at wakefield.gov.uk. I mean, essentially in terms of restrictions, I mean, it is that kind of hands, face, place, space. I know a lot of events have chosen not to run this summer just because they are still concerned that it would become an infection risk. So I think, you know, if people haven't had 2 vaccinations, they need to understand that does put them at risk if they're in a situation where they've got lots of contacts. You know, all the usual stuff like hand washing, you know, the hand gels, you know, making sure you don't have, because sometimes it's not the event itself, but it might be that people have to queue to get into the event. So really thinking through like every element of that event that you're holding, and also just kind of, you know, it is really challenging because there's these events are really important for people's health and well-being and their mental health, and also if you can't afford to go away on holiday, then having events that are local are really key. So I don't think it's about necessarily not holding things, but it is just about thinking about how those events are held and making sure that you can keep them as safe as possible. So, you know, one good example of this is if you have an event where people can just turn up, you know, you might want to think about, could you create a bit more of a barrier so people have to actually, you know, you're not just going to get a situation where like hundreds of people are going to arrive and they're all going to be milling around. I mean, if you're outside, again, you're much safer. So we know that if you're outside, you're far less likely to spread infection. I suppose the only other thing is that whilst we think that the restrictions are going to be lifted, I guess, you know, it is a little bit of a wait and see at the moment. I'm expecting them to be, but we're not with COVID. It's, you know, we have had a lot of surprises, haven't we, along the way. So I guess it's also just not, you know, having a bit of flexibility around what might happen in 4 weeks' time.
Thanks, Anna. And I know that there have been already some events that have been planned for next week that have had to be cancelled because the restrictions haven't changed, and they were planned because the restrictions were lifted. So unfortunately, there might be some situations like that. We have got Sam Walters back on the agenda next week to talk, as you know, who leads on the COVID enforcement team from a health protection point of view. So she'll be able to give us answer some more specific questions about that next week if people want to come next week.
Yeah, and then could I just say one more thing? It's also about public perception as well. So, you know, if you're a local charity and then you run an event and people are taking lots of photos and putting it on social media and it looks like there isn't social distancing and people are kind of crowding and people aren't wearing face coverings, and actually that can cause you some reputational damage. And we have seen that a bit where things end up getting in the Wakefield Express or on other media saying, you know, with the local public saying, why on earth did they do that? Didn't they realise it was a risk? Why aren't people social distancing? So there is something around that perception bit as well, and being seen to be kind of keeping people safe that's really important.
Thanks, Anna. There's another question there which is about young people turning up to a vaccination centre and expecting to receive the jab. Do they still need to be invited, and is there an age limit? So I'm not sure where we're up to in Wakefield in terms of ages. Is it over 25s or is it a little bit lower in Wakefield, Anna, at the minute? Do you know?
Yeah, so I think by the end of this week, they're saying that every adult, so 18 plus, will be able to book their jab. So I think, again, just checking like the NHS Choices website and stuff will just give you that kind of up-to-date information. The age limit at the moment is 18 plus, and that's because at the moment they haven't made the decision to take that below that. That's because with vaccination you tend to weigh the risks and the benefits, and because COVID doesn't cause a serious illness in people under 18, that's why they haven't considered a vaccination campaign. There's also some interesting ethical issues. So arguably, if you look at the whole world and you think about the fact that in some countries they don't, I think in Kenya they've got 50 million people in their population and only 1 million vaccinations. You know, is it right that we should vaccinate all children, where actually should we be thinking about providing vaccination, or at least not taking vaccination from other countries who have older people still to vaccinate. So it's quite a complex, nuanced situation. And we keep, you know, there hasn't been a decision made. Those decisions are held nationally. We don't get any say on that at a local level. So we need to wait and see. I think we've got a question from Mustafa about Eid prayers. So again, I think, Kerry,
shall I answer that, Anna? Yeah.
You've been doing a lot of work on that, haven't you?
So looking at the dates, it will be about a week before when we know if the restrictions are definitely going to be lifted. So I think it will be really sensible for our Muslim communities to plan for both eventualities. And we know from Eid just past that there are options for people to have to gather outside to pray, which is acceptable under the current restrictions. So it will be really good, I think, if our faith communities kind of planned for both eventualities and got that planning in place really early on. We'll happily speak to any mosque leaders to try and get that sorted for you and work with you to do that safely. But it does look like, it feels to me like a dual planning approach would be sensible at the moment. Would you agree, Anna?
Yeah, I think it's you know, I think
really frustrating when you can't.
Of the lack of certainty, but I think just being cautious, and we've been doing it for over a year now, so in one sense we're kind of used to it, but yeah, there's no definites at the moment.
Thank you. Next slide, please. So we just wanted to include a couple of things that weren't actually COVID today, based on some of the feedback that we've had that people will be happy to hear about wider kind of community events. So Sarah, do you want to quickly talk to this slide for a minute or two? Sarah, you're on mute.
Sorry, I didn't realise I were on mute. Yeah, so starting on Monday, it'll be Breastfeeding Celebration Week. I've been working quite closely with the team at FAB at the moment, which is a local support group. So yeah, the breastfeeding rates are pretty low in Wakefield at the moment. We obviously have given some information there around the data if you'd like to have a look on there, but yeah, just to push it out a little bit if you're available to do so. The local support is Families and Babies. I use them myself, to be honest, when I had twins, so I use them myself, and they're an amazing service. There's a breastfeeding helpline as well, National Breastfeeding Helpline, and there's also Start for Life, and they have a 24/7 service as well. They also have a new thing called Breastfeeding Friend, which is available like on Google and Alexa, so you can ask Alexa any questions at any point. That's my Alexa going crazy. But yeah, it's really useful information. Sorry, I didn't mute my Alexa, unfortunately. But yeah, but no, Families and Babies, if anyone's interested or would like to just share the information around Breastfeeding Celebration Week, that would be really useful.
Great, thank you very much, Sarah. And we know it's really important for long-term population health to have as many people breastfeed as comfortable and can if they want to. So moving on to the next slide. We also just wanted to highlight that this is Refugee Week this week. The national theme for Refugee Week is We Cannot Walk Alone. There are a number of local events which, as you can imagine, due to restrictions, are not open to the general public. And there's a regional event where people can go online and hear some inspirational speakers and have a discussion about new immigration plans and why asylum matters. I've just put a link to a local Wakefield district leaflet around migrants and refugees that we produced a few years ago now. And just to say a big thank you to all of the staff and all of the asylum seekers. We've had real enthusiasm for people coming forward for their vaccinations, real keenness for people to understand and take and kind of follow the COVID restrictions, and lots of great work that's been done. So I'd just like to thank, I know there's probably no one on this call, but I just want to put a thank you out there for the asylum seekers who've come to our country for sanctuary and really taken up that public health protection offer of a vaccination and really done their part. So thank you to them. And then moving on for the final slide, we have, I think, do we have Tom on the call? Are you here today, Tom?
No, it's not Tom. It's me. It's Jenna Fan. Tom couldn't be here. So
hello, welcome.
Hello,
welcome.
Thank you.
So welcome. The Wakefield Community Choir received some funding from our MHCLG Community Champions, COVID Community Champions Fund, and has produced an amazing song which some of you might have seen on the big screen in the ridings. Jen, do you want to say a few words about it while we just see if we could get that link to work?
Sure, I can. I have got it up on my screen as well. If I can share my screen, I can share it from my screen for everybody.
Brilliant. You share your
there.
screen
Oh,
then.
you're doing it.
Okay, so it's available for you to try and share, Jen?
Brilliant, sure. Well, I'll just say a couple of words about it first. So we got the funding, but we've been online for over a year now. Obviously, massively missing singing together as a group of singers. Our average age, I should point out, is 76 of our singers, but they have totally got on board with online, and we've produced loads of virtual concerts now, which have been sent out all over the country to care homes and independent living schemes. We're getting a huge following on Facebook, and it's really popular, and we're trying to spread some joy. So we got this funding and decided that we were going to write this song. So I asked the choir members to kind of get their thinking caps on and come up with some lyric ideas. We then sent that to a lyricist and a composer, and they came up with our song. But a song wasn't enough, so we decided to make a music video. We did part of that on Zoom and part of that out and about in Horbury as well, which is where we're normally physically based. So I will, if it's okay, I will share my screen and try and play that for you. So just a second.
So just a warning that sometimes we can see video but not hear the audio, and I'm very much hoping that's not the case with our upgraded Zoom link today, but...
Hang on a minute, let me just... It seems to have disappeared. Wait a minute. That's that one I want. Hang on.
So there's been some brilliant feedback, and I know that you were on the big screen in Trinity, weren't you? And people were kind of, it's a real heartwarming video and just nice to see everybody.
It is, isn't it? It's that everybody loved it as well. They all really, really got on board with it. Okay, I'm sharing now.
Okay.
Here we go.
Yeah, I can see your screen. Do you want to try and... Yes, it's working.
I check on my next door neighbour. I can't go in for tea. Have to stay and talk outside. Can't spread the laggy. The summer sun was shining and birds allowed to sing. Hope bloomed in that garden. What could the future bring? I checked on my next door neighbour, but she was all alone. Couldn't see her grandkids and all the friends she'd known. The autumn haze was golden, the fruit ripe on the trees. She felt the love and kindness of her close community. We're on the road to normal, where we can sing side by side with our vaccine and our roadmap. Let our voices be our guide. We're on the way to freedom. We can hug our family. Say goodbye to rules and lockdown. Our journeys be COVID free. I checked on my next door neighbour. She tried to cut her hair, was working out with Joe Wicks, all from her armchair. The winter wind was blowing, good news across the sea. They'd only gone and done it, a wonderful vaccine. We're on the road to normal, where we can sing side by side with our vaccine and our roadmap. Let our voices be our guide. We're on the way to freedom. We can hug in family. Say goodbye to rules and lockdown. Our journeys be COVID free. I checked on my next door neighbour. The curtains they were drawn. No answer from the doorbell. Was worried where she'd gone. But laughter in the spring air, it warmed my weary heart. United with her grandkids, no longer forced apart. We're on the road to normal, where we can sing side by side with our vaccine and our roadmap. Let our voices
So there you go. And we're hoping to be back together in person in September, hopefully, fingers crossed. Until then, we're still online.
You. Thank you ever so much. That was brilliant. I've seen it a few times now, and I'm sure I'm not the only person who had a bit of a tear to their eye there at some parts of that. So I'm glad you all enjoyed it, and thank you ever so much. Can I please encourage all of our COVID community champions to share that far and wide on social media with your families? Yeah, I can't thank you enough. Thank you for coming on, Jen. Okay, so shall we? I don't think there are any more questions in the chat. So without further ado, I'm going to bid you goodbye for this week. Next week's meeting is an hour long. We do have Sam Walters on the environmental health team coming to talk to us about some of the specifics about where we are and what we can do, and some other great speakers as well. So keep safe, everybody. Have a lovely week, and I'll see you all next week.
Thank you.
Thank you. Bye-bye.
Thank you.